We're now going to look at movements of the pelvis region, and from an exam perspective I would know these because it does crop up in an exam quite often. So the pelvis, what can the pelvis do? Well, if I turn it sideways we get what we call an anterior tilt. So the pelvis will bend forward like that. Again, most people that are overweight get a big mass on the front that forces the pelvis forward, creates what we call an anterior tilt of the pelvis. So that's anterior rotation. Pregnant ladies, latter end of pregnancy, develop quite a big anterior tilt, and it creates a lot of problems in the lower back, hence they get a lot of back pain. And it can be a big factor of people suffering with back pain in day-to-day life. If they do a lot of sit-in and things, you get tightness of hip flexors, for instance, that then pull that pelvis forward. Also, we can get a posterior tilt where the pelvis tips backwards. Then you can get a right transverse rotation. So imagine just this one innominate bone, it moves forward on its own, unilaterally. Or you can get a left transverse rotation where the left one moves forward on its own. It can also move backwards as well, but it's called a right transverse rotation or a left transverse rotation, and that's happening unilaterally on their own, just one side. Then you can get a right elevation where this hip lifts up, elevates up. Yeah, so we move, the whole thing slides up slightly, and we can get a left unilateral elevation. Then we can get combinations of them, so I could end up with an elevated and transversed right innominate bone, and that's all due to tight muscles where they become tight and short. When we look to the hip joint, what the hip joint can do, well, it can do flexion, so it comes up to the front like so, so that's flexion because we've decreased this angle, this working angle. When it goes back, it becomes extension, and then when it goes back beyond, it becomes hyperextension of the hip joint. We can also abduct and adduct. So from here we can abduct, take out. We can adduct, come back in. We can also get what they call medial and lateral rotation, or internal, external rotation, whatever you want to call it. So external rotation would be when the bone turns on itself like that. So this is with the leg straight. I'll kind of show you what happens with the foot because the leg stays straight, and as I roll the leg out, get that rotation, that's lateral rotation or medial rotation coming back the opposite way. And that's all happening at the joint though. So we get lateral rotation, medial rotation, and then finally we get circumduction, which is a combination of them all, where we go into flexion, abduction, lateral rotation, hyperextension, extension, hyperextension, medial rotation, circumduction. So they're all the movements of the pelvis region, and like I say, it would be worthwhile knowing them all.